All right, let's dive into the world of EMS triage. We're going to break down how paramedics make those split-second life or death decisions when the pressure is on.
So picture it. You're at the scene of an emergency. It's chaotic. Before they even start any treatment, a paramedic has to make one single decision that shapes everything that comes next. Any guesses what that might be? Well, it all comes down to one single guiding idea that they apply almost instantly.
And this is it. Err on the side of caution. This one little phrase is pretty much the bedrock of all emergency medical services. It's a whole philosophy, really, that's all about keeping the patient safe above everything else, especially when things are uncertain.
So how does a principle like that actually turn into action? Well, it guides the absolute most critical choice a paramedic makes on scene, figuring out what level of care a patient needs. And this isn't just about what they do right there. It's about the whole ride to the hospital.
And that brings us to this key term, ALS, which stands for Advanced Life Support. You see, if a paramedic thinks a patient is really sick or, and this is the important part, even has the potential to get worse on the way to the hospital, they're going to call for an ALS transport. That means more gear, more powerful meds, and just a higher level of care from the moment they close the doors. Now, to make that huge, sick or not sick call, paramedics always start with the fundamentals. And for that, we can use the adult patient as our sort of baseline model. What they're really looking for is the body's own alarm system kicking it.
And honestly, the best way to think about vital signs is like this. They're the dashboard warning lights in your car, right? A blinking light doesn't tell you exactly what's broken, but it screams at you that something is wrong and you need to investigate now.
And here's what those warning lights look like in the real world. For an adult, a blood pressure under 90, that could mean a problem with the heart or maybe a bad infection. A heart rate that's way too fast or way too slow is another huge red flag. Same goes for breathing and oxygen levels. These numbers give them a quick, objective picture of what's going on under the hood.
But, and this is a really big but, numbers can lie. This is where it gets tricky. Let's say a patient is on a beta blocker for their blood pressure. If that person starts going into shock, their pulse should be racing, but the medication can actually stop that from happening. So the paramedic looks, sees a normal pulse, but in reality, that patient is in serious trouble. And it's not just medications. Certain groups of people just don't read the textbook. For example, diabetic patients and women can have a massive heart attack without that classic movie-style crushing chest pain. For them, the main symptom could be something that sounds minor, like just feeling really weak. So you see, it's about so much more than just the numbers on a screen.
Okay, let's talk about our first special population, the elderly. With geriatric patients, the rules of the game completely change. Something that might seem like a small deal in a younger person can actually be a sign of a massive, life-threatening issue.
I mean, just take a hip fracture. In a younger person, it's a bad injury, for sure, but they're almost definitely going to recover. In an elderly patient, that same injury, it isn't just a broken bone. It's an event that comes with a shockingly high chance of death in the next year. The same injury has completely different stakes.
And one of the absolute biggest warning signs for an elderly patient is any sudden change in their mental status. It's so easy for people to just write off confusion as, oh, it's just their dementia. But for a paramedic, that is a giant red flag that kicks off an immediate, deep investigation. They never assume it's normal.
So what does that investigation look like? Well, they're running through a critical checklist in their head. First, check the blood sugar. Super low sugar can cause confusion. Then assess for a stroke. Look for any hidden signs of a head injury from a fall they might not even remember. And check for infections, because something as simple as a UTI can make an elderly person seem completely out of it.
All right, now let's switch gears completely and talk about another totally unique group. Children. You just can't assess a little kid the same way you do an adult. Their bodies work differently, they can't always tell you what hurts, and frankly, they're usually terrified. So paramedics use a very special tool.
It's called the Pediatric Assessment Triangle. The best way to think about it is as a super fast snapshot of how sick a kid is. And they can do it in like 3 seconds from across the room before they've even laid a hand on the patient. This is huge for keeping the child calm and getting a good read on them quickly. So the triangle has 3 sides, and they're pretty simple. First up is appearance. Is the kid alert? Are they interacting with you? Or are they just limp and listless? Second is work of breathing. Is their breathing quiet and easy, or are they struggling, using extra muscles, making weird noises? And third is circulation to skin. What's their color? Are they nice and pink, or are they looking pale or even bluish?
Just those three things tell a paramedic a ton. And of course, beyond the triangle, there are other big rules. They always try to get consent from a parent, and, whenever possible, keep the child with their caregiver to reduce stress. It's also interesting to note that sometimes these pediatric rules get used for older kids with special needs, too.
Okay, for our last group, let's look at intoxicated patients. Now, in this case, the assessment often gets boiled down to a really straightforward set of rules to figure out the risk level fast. Here's the first question the paramedic asks themselves. Is the person talking, but they're too unsteady to walk on their own? If the answer is yes, that situation usually just calls for basic life support, or BLS. It means they need a safe ride and someone to keep an eye on them, but they're not likely in immediate, life-threatening danger. But the whole game changes if the patient can't walk and they can't communicate properly.
This is an instant upgrade to advanced life support. Why? Because not being able to communicate signals a much more dangerous level of intoxication. You start worrying about serious risks, like them not being able to breathe. That patient needs a higher level of care, and they need it now.
So, we've gone through adults, the elderly, kids, and intoxicated patients. Every single group has its own playbook, its own set of things to watch out for. So what's the big takeaway here?
You know, when you boil it all down, it's this. The tools and the tricks might change depending on who the patient is, but the fundamental goal is always the same. It's all about using your training, your experience, and your gut to make one fast, accurate call, sick or not sick. And that one decision sets everything else in motion.
In the end, emergency triage isn't just about following a checklist. It's more like an art form, a way of seeing patterns and spotting risks that most of us would miss completely. Which kind of leaves me wondering, what are the hidden rules or the instant gut checks that shape the really critical decisions in your world?